with this new money, you're planning to open 100 pop-up clinics across 20 different markets by the end of winter. You're going to communities that need it most. Where are those communities and what are they experiencing?
Hi, Emily. Thanks for having me. 1 in 4 counties in the United States is what we call a healthcare desert. So those places will certainly be priorities for our pop-up clinic locations. But aside from the pop-ups, Carbon Health is going through a massive growth phase right now. We went from 7 clinics last year to now 30 clinics. And by next year, we will have 150 locations across 9 or 10 different markets in the country. So pop-ups are, again, part of our growth strategy, but we are also putting full-size clinics in many markets. And our plan is to reach 1,500 locations by 2025. So I don't think the healthcare industry has ever seen the type of growth in locations, access points that we will be going through.
Now, in many ways, you're using technology to scale up healthcare. So you were a healthcare provider that was sort of built to succeed in the pandemic. Talk to us about what kind of activity levels you're seeing when it comes to telehealth and telehealth appointment bookings. And is that simply the way that healthcare is going?
I would say we definitely see an significant increase in the usage of virtual video visits, but we are also seeing, Carbon Health has seen tremendous growth in both sides. We now have, I think, 7 times more patients than 1 year ago. The number of clinicians, the locations, everything has really grown by roughly 8 times in the last 12 months at Carbon, and telemedicine is definitely an important part of that. And what we think is going to happen is patients will expect the healthcare providers to meet them where they are, whether it's through a video visit or in a clinic visit, maybe in a pop-up place for quick testing, maybe with a device and remote monitoring, at-home testing. I think we believe that patients don't want their healthcare to be fragmented. So we call this concept omni-channel care. So I think the same providers providing care in multiple formats is going to be the dominant form factor in the future.
You also offer various kinds of COVID testing kits. You've got a program called COVID Positive Care for folks who have tested positive. How are you treating those patients and how much capacity do you have for that?
So the COVID Positive program is the most recent program we started. As you know, there are 10 million patients who tested positive, but we still hadn't seen anybody build a solution for the people who are positive. So I think we started onboarding first couple hundred people in our first pilot. But testing has been an area that we very actively participated in. We have done over 500,000 tests across really every modality you can imagine. At-home testing is an important part of it. We have mobile units, we have rapid tests. We have really been just focusing our energy on responding to this pandemic in every single way we can. In a way, you can argue that we took this pandemic more seriously than maybe even the US government.
How concerned are you about, continuing issues amidst the good news about the Pfizer vaccine? I mean, is it too soon to celebrate, given, it's going to be many more months and you're still seeing a lot of sick people?
So first of all, the Pfizer news are just definitely amazing news. The data looks really good. There's a lot to be optimistic about. But that said, it is not easy to manufacture, distribute, administer vaccines. It's a significant logistical undertaking. And we were foreseeing that, especially in the last mile healthcare access point, that would be a big bottleneck. So we have never vaccinated hundreds of millions of people a year. So to prepare for this, Carbon Health has been putting up these locations, pop-ups, containers, so that when the vaccine is finally ready for public use, we can distribute it, administer it as fast as humanly possible. So that actually will require significant challenge. Yes.
I imagine going into the holidays, there's going to be a lot of demand for tests as cases continue to surge going into winter. What are your biggest concerns over the next 2 months, in terms of meeting that demand?
So we have already seen, I think, 40% more demand in October compared to September. But this was expected for us. So we definitely expected an increase in cases around the flu season, which is now just finally, which is starting. And then we actually expect another surge when schools reopen, and then another surge when most companies go back to offices. So realistically, like this problem hasn't been resolved, and at every step there will be another surge, and hopefully eventually when enough people get administered, then we can go back to our normal lives.